Some of the topics on this week's Best Docs Network show featuring Forest Park Medical Center's chronic sinusitis with ENT Dr. Robert Wyatt, weight loss surgery with bariatric surgeon Dr. Nick Nicholson, pelvic pain with OBGyn Dr. Nicholas Lux, and fibromyalgia with anesthesiologist Dr. Peter Beck. Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network featuring Forest Park Medical Centers, one of the premier medical centers in all of North Texas.
Exactly right, Candace. We come to you from beautiful Forest Park Medical Center, Frisco, where a number of excellent physicians operate out of, as well as in Dallas, and that is where we find Kelsey Reich. Kelsey?
Thanks, Jim. One of the best ENTs performing surgery right here at Forest Park Medical Center, Dallas, is Dr. Robert Wyatt.
Well, prior to coming to see Dr. Wyatt, I was constantly clogged my nose, constantly having to blow my nose. I was carrying toilet paper around with me constantly and was just miserable. I couldn't smell at all, had a hard time tasting, and it really affected my lifestyle.
Jenna has been a patient of mine for a long time now, and she has very serious problems with sinus infections, sinus polyps, allergies, and associated problems with asthma.
I wanted to find out what was going on so I could breathe better and be functional.
She has a lot of problems with chronic sinusitis with the formation of a lot of polyps. It's driven by her allergic disease and underlying inflammation that she has all the time. One of the big problems she has is something I see very commonly where sinus problems are making asthma worse.
He explained to me that I had a lot of polyp development in my nose and that he needed to remove them so that way I could breathe better and that way everything would flow more clearly and I would be able to smell as well.
So one of the things that happens to her when her sinuses start causing trouble is her asthma gets a lot worse. I would never be able to cure her, but I would be able to dramatically improve her quality of life by cutting down on the medicine she had to take all the time, improving her breathing through her nose, her sense of smell.
Dr. Wyatt has changed my life in many ways. First of all, being able to smell my own perfume. Yeah, he's definitely changed my life. I can taste food again, I can make trips with my husband, and I can have a normal life. I love being able to smell flowers.
And she's one of those people, unfortunately, that I have not been able to go in and cure with a single surgery, but because of the minimally invasive techniques that I'm able to employ now, even though she requires surgery to clear out polyps every 18 months to 2 years or so, she's able to get that done and tolerate that with very little downtime.
He is a great doctor. I love that he explains things to me well. He shows me things. He helps me out with new medications if I'm on them. He coordinates really well with other doctors. I just love Dr. Wyatt and his team. I would definitely recommend Dr. Wyatt.
The main part that prompted me to call Dr. Nicholson to have the surgery is I was at a pool with my youngest daughter and she wanted to go down the water slide. Just the fear of taking off my towel, going swimming with my kids was a big downfall with my weight. So I finally decided that the only way that I was going to make myself feel better physically and mentally was to look into having the surgery.
Traci just got to the point where she's basically a very happy, fun-loving person that was just always very carefree, and her weight got to the point where she was no longer happy.
I think one of the best parts about Dr. Nicholson's clinic is that when I first thought about doing the surgery, I didn't know what to do. I have insurance, but I don't know what my insurance covers. So when I called their office, I told them, gave my insurance information, and they took care of all of that. They called the insurance, they told me what they covered, they told me what my copay was. I didn't have to do anything.
Traci ultimately decided on a gastric bypass, and And she's worked very closely with us for a long time before deciding on that. So I think she made a very well-educated choice for her unique situation. The surgery was the easy part. I mean, I really think that is the minimal amount that needs to be done. That's the 10%. The art, if you will, in the practice of this medicine is the other 90%, and that's treating the issues for why people are overweight. Let's face it, the reason people are overweight is going to remain after they have surgery.
The surgery is only a certain part of the whole actual act of having weight loss, and then afterwards you have to worry about what you're going to eat. The dietitian you go to, they go through what you can have, what you can't have, teach you how to go through the labels, and it seems very daunting at first, but once you really, really get into it, it's very easy. So
many people come in thinking, well, I'm going to have surgery on Monday and I'm going to lose weight on Tuesday. And the reality is it doesn't work that way.
If I could just take Dr. Nicholson's group and just put them in a little package with a little bow, I would say, this is what you need to do, because it's everything. It's the whole package deal, and that's what I loved about his office.
Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way.
For individuals looking to take a few years off their appearance, Dr. David Azouz, a plastic surgeon who operates right here at a beautiful Forest Park Medical Center, can help.
A couple of years ago, I decided that I needed to make some lifestyle changes, and I lost about 50 pounds and just started to get healthier, and I started feeling so much better, and I decided that I really didn't look as well as I felt.
Donna's a very attractive woman. I think she has beautiful bone structure. Although she does not dye her hair and she has white hair, she has a very elegant look. But I think she had very prominent jowls. She had an obtuse cerviconuchal angle, which means that her neck went from her chin down straight, which you could see in her preoperative photography.
I didn't want to look like a 25-year-old. I just wanted to look like my well self. He did my eyes, underneath my eyes, the bags under my eyes, which really made such a huge difference. And, pulled up the neck, and, so that this is really clean in here. And I had, with the weight loss, I had a lot of hanging skin, and he, took that away, so that was wonderful.
Afterwards, she looks natural. She just looks a lot younger and a lot better. I mean, people I don't think would believe that she was in her mid-60s.
As of right now, I'm about 6 months post-op. I'm thrilled with it. I really am. It looks natural. It doesn't look pulled. I look now like I feel.
So overall, you have a very natural and refreshed look. You look like you've been vacationing, or you're well rested, and people know you look a lot better, they just can't place it.
You really have to be comfortable with the doctor that you're going to. He answered every question that I had, didn't hesitate to say, if you change your mind the morning of the surgery, it's no big deal. It's up to you. Nobody's pressuring you. So I just felt comfortable with him.
Did you know that in 2011, Forest Park Medical Center was voted as one of the top 20 most beautiful hospitals in the United States? Also, Forest Park Medical Centers were the only hospital in Texas to make this prestigious list. Cindy had trouble losing weight until she met Dr. Kim. To find out more about Cindy's story and other life-changing stories, log on to bestdocsnetwork.com.
One of the most common problems that a lot of women do not know much about, or a lot of women haven't even heard of it, is a condition called polycystic ovary syndrome. Women who have irregular cycles, or they have a history of missing a lot of cycles, or they have overt pelvic pain, are often found to have this condition.
Before I came to Dr. Lux, I was having a lot of irregular periods, and I couldn't even walk sometimes because my pains were just really bad. They were sharp, and just getting around, it was just really hard for me.
Now in Marley's case, she came in about a year ago with symptoms that are very typical of PCO, and that consisted of irregular cycles and pelvic pain. We did an exam, pelvic sonogram. Turned out that she has polycystic ovaries, and she also had some findings I thought might be typical of some other conditions that can cause pelvic pain, such as endometriosis.
So Dr. Lux sent me here and had the sonograms. And then after I had the sonos, and it showed that I did have the polycystic ovaries, which was cysts around my ovaries. I had one big cyst, but then I also had several different little ones too.
Treatment of PCO and pelvic pain consists of a surgical option versus a conservative option. It depends on what your goals are, it depends on the severity of the symptoms. In her case, she was in pain and she wanted to do something about that.
I went in the Thursday before and had the pre-op, and then after I had the pre-op done, they kind of told me, you know, how long I was going to be out of work, and which is I was only out of work a week. I was there like probably an hour after the surgery in recovery, and then I was able to go home that same day. If any woman is having pelvic pains, I highly recommend seeing Dr. Lux.
Forest Park Medical Center set themselves apart by being committed to providing their physicians the latest state-of-the-art technology in medicine. As this week we feature the OArm.
This is what's called the Medtronic OArm. It's a combination of traditional fluoroscopy with also a three-dimensional imaging component. Within 26 seconds, it will take 755 high-definition images. With the OArm, we can actually take shots of the spine in a three-dimensional nature because the spine is a three-dimensional structure. And the value of that to a surgeon is that they can now see the spine in 3 dimensions and truly be able to determine with precise accuracy their placement of the hardware. The device also enables minimally invasive surgery. By more precisely placing the screws, he's going to be able to allow the patient to have a quicker recovery time and hopefully have a better quality of life post-surgery due to the more accurate placement of the hardware which the OArm enables. We have the OArm itself, which collects the images. We have the viewing cart, which the images are reconstructed on. And then we also have the stealth navigation image-guided surgery unit. After the images are recreated on the spinal navigation unit, the surgeon is able to bring different surgical instruments into the field that will help him more effectively place the instrumentation into the patient's back in a three-dimensional nature. Because this device is used intraoperatively, the surgeon can use the image-guided surgery unit to do the remainder of the case without additional radiation being delivered to the patient. The benefit of that is to the patient that they will potentially not need to be sent for a post-operative CT to check the final placement of their hardware, since they're able to do that real-time in the operating room.
Each week we continue to receive emails from viewers who have questions pertaining to their health. With that, we take a look at this week's Ask the Forest Park Doctor.
Stephanie has a question for Dr. Pero. She'd like to know, can someone with severe allergies be helped with surgery?
A lot of patients have severe allergy problems, and many of them also have chronic sinus infection problems and or nasal obstruction. Sometimes those patients can be helped with surgery. Typically like to make sure that we have their allergies under as good a control as possible before deciding to proceed with surgery. In other words, the allergies themselves might be contributing to swelling in the nose, which could be contributing to blockage of their breathing, could be blocking the openings of the sinuses that lead to sinus infections. Our hope would be that we could treat the allergies by themselves, which would decrease the swelling enough to improve their airway and decrease the severity and frequency of the infections. In some patients, based on their anatomy, that's not possible, and those patients are ones that would benefit from surgical intervention.
For more information on any of the great doctors you've seen on today's show, head to the website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
That's right, Jim. Forest Park Medical Center and their physicians are dedicated to helping change people's lives, just like our next physician, who Kelsey has more on.
Thanks, Candace. Next is one of our top physicians, Dr. Jonathan O., who operates out of Forest Park Medical Center, Frisco, to discuss the latest cancer research and treatment for women.
Here are stages of cancer. Basically, stage is just a way of classifying how far the cancer has spread. And every disease type has their own way of staging things. So the staging for breast cancer is not going to be the same as staging for ovarian cancer, obviously, because it's completely different diseases. But that's generally what we're trying to do, is trying to get an idea of how advanced the cancer is. And once we know how advanced the cancer is, we can generally give people an idea of what the prognosis is. That's ultimately what's important. You're not so much worried about stage, you're more worried about, are you going to be able to cure this? So, and stage kind of gives us an idea of what the cure rate would be. For gynecologic cancer, after surgery and what we call adjuvant therapy, and adjuvant therapy will just be either chemotherapy or radiation after surgery, patients undergo what we call surveillance. Surveillance is just a fancy term for keeping a close eye on things. Typically, we have the patients come back into the office anywhere from every 3 to every 6 months for an exam and blood work. We want to keep an eye on things to make sure that the disease doesn't come back. Chemotherapy is just a fancy term for medical therapy. Traditional chemotherapy is an IV infusion. So just like if you were to go to a hospital, you get an IV placed, and these are medications designed to help kill cancer cells. And for the most part, the way I describe it is it's very expensive, very well thought out poison. And it's poison that's designed to help kill cancer cells before it causes too much damage to normal cells. Length of treatment depends on the type of cancer the person has and the treatment option that they decided for. But usually it's about a 18-week treatment course. There's a number of trials that are ongoing through our research division that's based out of Mary Crowley here in Dallas. We have a number of clinical trials open for not just gynecologic tumors, but also breast cancers and multiple other disease sites. We have targeted therapies. We also have tumor-specific options, such as vaccines. So a lot of these tumor vaccines are created at the time of surgery, where samples of a person's tumor is sent to a lab, and this lab creates a vaccine targeted specifically against that person's tumor. That's something that's under clinical trials here in Dallas that I'm very actively participating in.
Fibromyalgia can be a very painful disease, but thankfully one of our fine physicians from Forest Park Medical Center, anesthesiologist Dr. Peter Beck, has come up with a wonderful solution.
I was diagnosed with fibromyalgia 5 years ago, and I was experiencing chronic pain, exhaustion that wouldn't go away. I actually met Dr. Beck through his wife. Somehow the conversation that I had fibromyalgia came up, and she said, my husband is doing a new study. It's called a PSTIM. And I was like, and she explained that it was for chronic pain, arthritis, fibromyalgia. It was FDA approved.
What is nice about PSTIM for patients is that there is very little prerequisites required to place this on. Outside of the contraindications of pregnancy or pacemaker, any candidate can benefit from PSTIM.
He installed it right there, and there was no drugs. I drove myself there, I drove myself home. Within 4 minutes of him putting it on, my headache started decreasing, and my pain started to ease up. And by that evening, I just felt great. And somebody said, you just look happy. And I was like, well, I'm not suffering from that chronic fatigue and that chronic pain.
There is a lot of skepticism initially with using PSTIM. But I've read the articles, I read the journals, I spoke to patients, and I came to realize that this actually will be beneficial to patients. So I took the initiative to talk to the distributor and made plans to be trained in the use, and that's how I became the first physician in Dallas to be licensed to use this device.
And my husband's gotten his wife back. My children have gotten their mom back. I don't complain. I'm happy. I feel great, and I'm really excited about it.
What I find rewarding about PSTIM is that I can finally offer patients a non-pharmacologic way to help patients manage their chronic pain.
Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
We were going down a back road, and there was a group of dogs that I could see in front of me, but apparently there was one left behind, and it came out of my blind sight, and when I finally saw it, I swerved. And when I swerved, it slammed me into 2 oak trees.
When Brittany came in to see me, she had a profound hearing loss in that ear from the car accident. Something associated with the accident affected the continuity of the 3 little hearing bones in her middle ear.
When I was in the hospital bed, if I was laying on my left side, my right side I couldn't hear anything. I think there's something wrong because I could hear perfect. Now it feels like my balance is off. I can't hear y'all when I turn my head.
I tell the patient that they have an option to repair their eardrum and repair the hearing bones within their middle ear cavity. And I go over with them the anatomy of the middle ear, and I talk to them about the fact that a surgery can be performed to look into the middle ear, see what the problem is, and at the same setting to repair whatever it is.
Dr. Hahn knew exactly what he was doing, and he was taking it one step at a time. He wasn't, okay, well this is what we need to do, and then we need to do it now. He was doing it step by step by step. And the first step that Dr. Hahn took was taking an ear test. And when he had found out how bad the results were, that's when we started taking more steps towards getting surgery done.
I lifted up her eardrum, looked into her middle ear, and it was apparent that the 2nd hearing bone had actually been misplaced off of the 3rd hearing bone. So there was no connection between the 2nd hearing bone and the 3rd. When her eardrum would vibrate, it wasn't vibrating into the inner ear at all. We actually replaced her 2nd hearing bone with a prosthetic hearing bone, and within days, she noticed a significant improvement in her hearing.
Amazing the results that I had, and ever since after the surgery, I mean, I've been just upscaling from there. If I knew someone who was having the same problem as I was, I would definitely recommend Dr. Hahn. He's a great physician, and he treats you like you're a person and not just another patient.
Forest Park is pleased to announce the newest addition to their family of fine medical centers, Forest Park Medical Center Southlake. Excited to further serve the DFW Metroplex by extending their reach to the Southlake community. Slated to open June 2013. At Forest Park Medical Center Southlake, experience state-of-the-art medicine in the world-class facility. From staff and surgeons to technology and techniques, they have brought together the best of the best, pioneering the most cutting-edge and minimally invasive procedures available. With the same top-notch service and high-quality care you've come to expect from Forest Park Medical Centers, combined with the latest high-tech devices and fully integrated operating suites, this is extraordinary and then some.
Before I went to go see Dr. Roshek, I actually had seen my family doctor because I had some pains down the growing area. It was severe pain. It hurt to walk. It hurt to do basically just anything, really. And it became too severe for me to handle.
Groin hernias either can be one-sided or both-sided. Typically, if a patient has a one-sided groin hernia, I recommend the open hernia repair for that patient. I make an incision in the groin, we fix the hernia, and we'll typically use a piece of mesh to repair the hernia. If the patient has a dual-sided groin hernia, I find that the laparoscopic technique is more beneficial because we can make this small incisions that we use for the laparoscopic technique and fix both hernias at the same time. We found that the laparoscopic technique and the open technique are very similar in regards to durability of the repair and recurrence. However, we've seen that the laparoscopic technique allows patients to go back to work sooner, and a lot of times we'll have less pain in the postoperative period.
When I went in to see Dr. Roshek, he did the full exam again, and at that time he discovered a second hole in my intestinal wall.
So in Anthony's case, he was starting to feel growing pain, and he thought it was just on one side, but it turns out that when I saw him in the office, he actually had a hernia on both sides. And this hernia was really making it hard for him to do what he loves, which is mainly he likes to hike. And when he's hiking, he participates in geocaching, where basically you're on a glorified treasure hunt. So it was really holding him back from that. He was noting a lot of pain when he was trying to go hiking and enjoy his life. Once the hernias were diagnosed, we settled on the laparoscopic technique to fix both sides at once.
After the surgery, it was 3 or 4 days. The surgery was on Wednesday. Not being one who likes to be cooped up, a very active kind of guy, I like to be able to get out. From then, it was a little bit more at a time. By Monday, I was back at work.
And since surgery, he's been doing great, and he's out there hiking and geocaching all the time now.
Dr. Roshek, as a doctor, he was extremely welcoming. He's extremely friendly, extremely open, a very good person.
So reflux disease can be treated initially with taking medications. Antacids, over-the-counter medications are very common. When your reflux becomes more severe, then people tend to go on to medications on a daily basis, which is really not what those medications are designed for.
I was always having to worry about taking medicine, having the medicine with me, and really had to watch what I ate. I had the heartburn and everything for about probably 5 or 6 years before I finally went to the doctor and did something about it.
Medications are really a chemical treatment for a mechanical problem. We're chemically changing the composition of the fluid, but we're not changing the mechanics that keep the fluid in the compartment where it's supposed to be. And that's what surgery does.
When I went to see Dr. Ihde, he explained to me what was actually going on, and then we just set up a scope to go in and check and see if I did have a hiatal hernia and what exactly was going on.
The fundoplication procedure is done with a new device called the Azouz device. And we pass that with a TV camera into the mouth and down the esophagus and into the stomach. And then it folds back on itself so that we can attach to the junction of the esophagus and the stomach. And it has a flap that will fold the fundus part of the stomach onto the esophagus and then put the sutures in.
The surgery went in and corrected the hiatal hernia where the stomach had gone up through my diaphragm, and he fixed that. And then the transoral incisionless fundoplication rebuilt the valve so that the stomach acid couldn't come back up my esophagus.
We usually have them on a 2-week diet of liquids, soups, and then we spend the next 4 weeks with soft foods. And then at 6 weeks they can go back to eating the beef, chicken, raw fruits and vegetables, those sorts of things that are a little harder to get down and would put more strain on the repair.
I'm not in pain every day. I don't have to worry about when and where I've got to take medicine. I can eat whatever I want. It's been great. It's changed my life for sure.
Well, that'll do it. That'll wrap up another edition of the Best Docs Network featuring Forest Park Medical Centers, some of the best medical centers in all of North Texas.
And if you want to check out any of the outstanding Forest Park Medical Centers doctors, you can do so. Log on to the website, bestdocsnetwork.com, and click on the Forest Park Medical Center tab.
That's right, and as always, if you have a question or comment for us, we would sure love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We'll see you next week.